Okay. We'll start now. Good afternoon, ladies and gentlemen, and welcome to the annual general meeting of Basildon and Brentwood CCG. Thank you for coming on this afternoon. My name is Dr. Boyetayo, and I'm chair of the governing board of the CCG. We appreciate your presence today. Before we start, I would just like to mention some few points. This event is being recorded as it is live. It is to enable the live function to work effectively, but it's also to enable us to record the minutes very well. We will keep the record for 14 days to achieve this. If you do not want to be involved in the recording, you can either excuse yourself from the meeting or do not participate actively. For those who want their names to be included in the minutes, you can declare your name or office in the question and answer button, which is on the top right-hand screen. While we're progressing to enable us to enjoy and listen effectively, I will ask you to mute yourself unless you are speaking. There will be a slight delay when we change the slides and also when the speakers are speaking. This is because of the technology, so do bear with us. The AGM is an opportunity for us to show the activities of the CCG over the past year, which for all of us has been an eventful one. And I would like to put it on public record, the appreciation of the CCG to all our staff, both in the NHS and social care, the voluntary sector, local authorities, and indeed members of the public who have persevered with the restrictions imposed upon all of us by COVID. This is, of course, going to be an ongoing challenge, and we will need to work together in order to come through this. I would like to introduce our presenters, who are also members of the governing body. I'm Dr. Tayo, like I said, if I go from right to left. Anthony Makiva, who is unfortunately not with us this afternoon, is the executive lead of the Mid and South SS and Health and Care Partnership and the joint accountable officer for the 5 CCGs. William Guy, who's been standing for him today, is also the NHS Alliance Director for the Basildon and Brentwood CCG. Emma Timpson is Director of Planning and Performance, Natalie Brody, Deputy Chief Finance Officer, Eleanor Sherwin, our interim head nurse, and Jill Jones, who is a lay member of the Board on Patient and Public Involvement. This will be the agenda I'll be following today. The report which will be done by William on our last year, which is 2021. The annual report and accounts will be presented by Emma Timpson, and we'll move forward to plans for place. As part of our requirement, we will need to approve the annual report, after which we will proceed to the question and answers part. The question could be posed by people using the Q&A button, like I said previously, and the answers will be delivered by a member of the executive team. If we are unable to answer the question today or we run out of time, this will be communicated via email. Next slide, please. So I will now ask William Guy to present our first set of slides. Thank you, William.
Thank you, Dr. Teo. When we met this time 12 months ago, we'd just gone through the first wave of COVID, which presented a huge challenge to the NHS and beyond. I think it's probably fair to say that that continued to dominate an impact on the way we could deliver services throughout 2020, 2021. And indeed, last winter, we were tested in a way that I think the local health system has never been tested before. And I'm pleased to say we came through that challenge and managed it well, but in no small part thanks to a huge number of stakeholders that have participated and supported the NHS and the communities we serve over the last 12 months. Obviously, a key factor in coming through that was the vaccination programme, which started last December, on a very cold December day when we saw health and social care workers and the elderly access COVID vaccinations, and they came in their droves. And thanks to the efforts of primary care, EPUTs, the hospitals, and some community pharmacists, we managed to vaccinate now 84% of the population across adult population across Mid and South Essex with their first doses, and 78% with both their first and second doses. And indeed, we've now commenced the booster programme to try to ensure that we're ready for winter and the challenges it presents. A key part of the work we've been doing since we last met is around reset and catch up. As has been reported in national media, the impact of COVID on the NHS has been stark. It's obviously changed the focus of what we could work on. We had to respond to the waves of COVID that have come and heavily impacted on the health service, and then try to remedy and catch up on the work that unfortunately couldn't be seen during that period. It has been challenging and remains a challenge, and as you'll see in the numbers that we go through today, there remains significant challenge for the NHS as we go through the next few years, but it's a challenge that both the CCG and successor organisation that we will become, and all of the stakeholders want to embrace and want to get on with. That leads me on to my next point, which is around the fact that this will be the last AGM whilst we're still a CCG, so there'll be an AGM next year, but we will progress into being an ICS. So across the country, there will be ICSs formed, integrated care systems, which will see us working more closely with health and social care colleagues, as actually we have been during the COVID period, and we'll build upon the relationships we've established with health and social care colleagues in order to better meet the wellbeing needs of our population. As you can see on this slide in front of you, we haven't stopped working throughout the COVID period, and whilst COVID has been the significant factor and focus of the NHS's attention in the last 12 months, as you can see, there's a huge amount of work that's been happening around that. I'd particularly like to draw the attention to the fact that 5.4 million consultations were undertaken by GP services during 2021, and 58% of those were face-to-face. I think we acknowledge and recognise that it is challenging to get access to NHS services at the moment, primary care, secondary care, out-of-hours services, and because of that demand that's placed upon service at the moment. But all elements of the NHS have been operating throughout COVID, trying to meet the needs of patients both with COVID and other health and social care needs, and that work continues. If we move on to the next slide, please. Thank you. So some of the key successes of 2021 that we want to draw upon. We can't go on from this point without mentioning the local response to the COVID pandemic. So as I said before, last December and January tested the system beyond anything I've ever witnessed in my 20 years in the NHS. And actually it's through the combined efforts and collective efforts of people working within the CCG, health and social care partners, and just the general public that we managed to come through that as well as we did. The demand, particularly in the kind of early new year, on the hospital services was phenomenally high, but we were able to maintain business as usual during that period to make sure that we could respond to needs. And thankfully, the pressures on beds as a result of COVID quite rapidly reduced across February and March, in no small part thanks to the vaccination programme. The local workforce is core to that, so across the whole of the health system and beyond, people that have done the necessary to get through the challenges that present and continue to do so. Whilst we're not in the peak of the pandemic anymore, there continue to be implications of COVID throughout the way we operate, and the local workforce have been resilient and responded to that well. They've had to change the way they work, what they do, and deal with different challenges and ways of delivering their services. And they've stepped up to the plate to make sure that they can maintain as much provision as possible. We quite quickly responded to the COVID pandemic to make sure people could access face-to-face primary care, and a key part of that was establishing respiratory hubs, which we did not only in Basildon and Brentwood but also across Mid and South Essex. This meant that patients with COVID symptoms could be seen safely in a primary care setting, which was important both for the safety of other patients and of our staff. And those continued operating up until June of this year. As I said before, there's nothing like an incident, and particularly a pandemic, to encourage working across stakeholders that we wouldn't necessarily previously worked with. And COVID has really enabled us to build upon existing foundations of partnership working with partners across Mid and South Essex, but also to establish new partnerships. And we'll be wanting to build upon those and take that momentum forward as we establish the integrated care system. And try to meet those broader wellbeing challenges that we're desperately keen to tackle. An awful lot of the CCG's focus has been looking at primary care network development over the last 18 months, 2 years now, and that includes establishing a number of new roles in primary care. So you will start to see, as kind of normal business practice, pharmacists, physios, social prescribers and beyond as part of those practice teams, so kind of beyond your traditional roles of GPs, practice nurses and healthcare assistants. And that's in part to respond to the demands placed upon primary care, but in part to try to better meet the needs of patients presenting to primary care. We know that not everything needs to see a GP, and in fact there are many issues that patients present with that are better tackled by somebody else, and that's why we're introducing those roles, and we'll continue to do so over the next couple of years. We've started to roll out a new model across primary and community mental health services to try to better meet need of the population that we serve. So rather than wait for people to escalate and require secondary mental health services, we're trying to intervene at an earlier point in a patient's progression to try to better improve management early on, and we've seen some initial success of that programme. At the moment, that model is kind of establishing itself and trying to go through teething issues, etc. But we feel there's some real signs of success that we want to build upon going forwards. We have put in place additional bereavement services throughout. We recognise that the impact of COVID has meant that demand on bereavement services has been greater than it usually has, and we've worked with hospices and other partners to make sure we can respond to that. We've also had some real success working with stakeholders to try to support children with low school attendance. So we recognise that particularly in Basildon, we have poor outcomes for patients attending local schools, and to try support addressing that, we've worked with a small number of targeted children but who have low attendance because of their poor mental health, and again we're seeing some good signs of success with that and want to expand that programme over the coming months. Move on. So I think it's probably fair to say that as well as those successes, we've clearly got a number of challenges, and as you would have seen played out in the national media, we're not unique with those challenges. COVID-19 is still here, and we're still having to manage a health system that's both responding to the fact that there is an ongoing pandemic, looking forward to what winter might bring in terms of that pandemic and flu. and recognising that actually the delivery of normal services has to change whilst you try to control infection, etc., because of the risks of COVID-19. At the same time, we're trying to restore services, and that's actually possibly more complicated than trying to tackle COVID itself. I think probably during the first wave of the pandemic, we were able to focus all of our resources at responding to COVID, and actually trying to run normal services alongside responding to COVID is actually the bigger challenge, and that's what we've been finding in the last 12 months. As I've said before, the demands placed upon the NHS are higher now, so we experienced a period of time when the population didn't present to the health service in the main, either because of fear of risks associated with the spread of COVID-19 or because they wanted to release the NHS to focus on COVID-19. Quite rightly, that demand is now coming back into the system, and that's being felt across all sectors of the NHS. We've got ongoing workforce problems, so we've got challenges across the system in terms of recruitment and retention of a workforce, and that continues. I think we're particularly cognizant of the fact that COVID-19 runs the risk that it increases the number of people entering into retirement, and so we will continue to work with all partners to try to strengthen our workforce, but that does remain a key risk to the NHS. And also locally, we know we've got consistent problems with the maternity services at Basildon Hospital, and there's a significant amount of work and effort placed both by the hospital itself and CCG partners to try to address those issues. We move on to the next slide. I think I'm going to hand over to Emma, who will take you through the performance reports.
Lovely, thank you, William. So as William said, COVID-19 and the pandemic had a significant impact on our performance across the board against the national standards. If we can move to the next slide, please. So as a result of the pandemic, a number of services were suspended during the time, and resources and workforce were redeployed to ensure that we responded to the particular crisis that was happening. And this has resulted in a backlog in non-COVID care, in particular, across a number of our services. So in terms of the specific performance areas, cancer performance and against the 2-week wait standard, whilst we did achieve the standard in March 2021, 94% against the target of 93%, we hadn't consistently delivered that across all of the months. We have some dedicated Macmillan GPs which are working with our practices to ensure that those individuals that require a referral to specialist services, that referral takes place. Then in terms of the 62-day standard from referral to treatment, we achieved 66% against a standard of 85%. So we have across the system more people waiting longer than expected. We do have a recovery plan in place, which is being worked through with all partners across the systems to tackle that particular challenge. One area which has been significantly impacted is in relation to the referral to treatment times, the 18-week target, where we achieved 64% against the 92% standard. Currently, our focus is on those individuals that have been waiting 104 weeks for their treatment and ensuring that they are treated before the end of March this year. And the services continue to prioritise those which are clinically urgent. But as William pointed out, I think this is going to be a particular challenge for us going forwards in terms of recovery of the waiting list. In terms of diagnostics, 6 to week wait performance, we achieved 61% against a 99% target, and in particular endoscopy procedures were significantly affected as that service had to be ceased due to the risk of COVID transmission. So that has been a challenge. We are working across with providers around increasing our capacity to be able to ensure that we can deliver to the standard going forward. Also, emergency services were impacted with the pandemic, with more phone calls coming through to 111 as people had greater queries around COVID, which meant that 84% were dealt with within the 60 seconds, opposed to the target of 95%. A&E performance was 89%, and that was against a target of 95%. We did see that there were some delays in handovers from arrival to handover to the hospital staff. So we had almost 7,000 breaches across Mid and South Essex during the year. In terms of referrals through to our talking therapies, our IAP service, across the Mid and South Essex footprint, 21,000 patients access the service against a target of 27,000. As William mentioned, we did see a hesitancy in patients coming forward to their GPs and for being referred on. We've seen a recovery in terms of those referral rates now, and the system and that service, continues to provide a mixture of non-face-to-face and face-to-face appointments. So that's a summary of the performance against the national standards. I'd now like to hand over to Eleanor Sherwood, who will talk through the quality performance. Thank you.
Thank you, Emma. Thank you very much. Hello, my name's Eleanor Sherwood and I'm the Interim Head of Nursing at the CCG. And I've just got one slide actually that I'm going to talk you through from a quality perspective. So if we could, thank you. It's really interesting. I was reflecting the other night as I was walking the dog, as you do, that actually I actually qualified as a nurse in 1987. And very quickly went into working in palliative and end-of-life care, where I remained for over 20 years before I joined a more broader quality scope. And actually, all of us, we've never experienced or worked through a global pandemic. But actually, whilst it's brought immense challenges, it had also brought to us some positives in terms of, and William's already alluded to this, how we've worked together as system partners, how we've come together, how we've focused on patient care and care of the families. And I think I'm actually really, really proud of how as a system we have all worked together. And William has already said a special thanks to staff, and I'd just like to reiterate that, because whilst we've been working in CCG land and have been under a tremendous amount of pressure for our frontline staff working in primary care, working in the hospitals, working in the community services, the hospices, etc., they've experienced and reacted to unprecedented demands that I think has taken a tremendous amount of courage, and I would just like to personally say thank you. So in terms of quality and transformation, I think we learned very quickly with COVID that we needed to find a way to ensure that we were able to support families and patients and everyone across the system. And COVID shed a light on what we can achieve and what we did achieve, and also has helped set a precedent as I think we move forward to transition to becoming an ICS. William already mentioned about the hospices working together, and I was delighted to be leading on end-of-life care across the system during the initial phases of the pandemic, and we were able to bring the hospices together to work together and to be productive and to actually really support each other during the pandemic. And I was just talking to one of the chief executives earlier today, and she just said that work was phenomenal and how that's continued to impact on the care that they've been able to provide, but also how they're working together as hospices. So I just think that's absolutely super. With IPC, as it says here, wow, what a response to the pandemic. And COVID really was the only game in town for our IPC teams. And they have been absolutely inspiring and have worked tirelessly with system partners. They brought together teams across CCGs, care homes, public health, local authorities, to actually really support our providers of care and to enable people to remain as safe as possible within their own homes, be that home or the care home in which they were living. Continuing healthcare, we've been working to set out a programme for consistency and fairness and how do we support the system. But I think I'd just like to mention our continuing healthcare colleagues in particular had to react and adjust their normal working practices when the pandemic hit. Many were redeployed to support system partners, the acute trust, the community hospitals, to facilitate discharges and to enable the flow of patients safely out of hospital. They also set up a programme of welfare checks for those people who were receiving support through continuing healthcare and who were living on their own. From a quality and safety perspective, patient safety perspective, we never ever lost sight of that throughout the pandemic. But I think what I'd just like to raise is about our safeguarding colleagues and the work that they did. That very quickly became an area of concern in terms of the increase in domestic abuse, the hidden challenges for the elderly and the vulnerable, the challenges for children and young people. And we made a decision to ring fence our safeguarding staff so they were able to continue to work tirelessly to protect our population and to enable them to work jointly with the local authority. And they have continued to do some fantastic work throughout 2021. And again, the partnership working that's come from that, I think is providing some really excellent groundwork as we transition into an ICS. In terms of patient experience and clinical effectiveness, this has absolutely remained a priority. There's a patient experience strategy which is being developed. And actually the real focus of that strategy is to focus on co-production, so championing co-production. What we've also done is developed a suite of patient stories which are being presented at board. And actually, I think these are proving to be quite impactful because actually, certainly from my perspective as a nurse, and I'm sure the other GPs, etc. in the room will be able to agree with that, is when you hear that patient story firsthand, it makes such a difference to perhaps how services are viewed, and it brings up things that we haven't thought about before. An example from that was a story that was shared in relation to a gentleman who was diagnosed with cancer and how he was having to travel up to London for treatment, and also some very difficult and challenging conversations. And what that story led to was a review of the cancer pathways and actually how we can best support people, which I just think is super important. And I think those patient stories are going to become even more invaluable as we move forward. In terms of regulation, we continue to work with and support CQC. But I'd just like to highlight that actually in BB we have 35 GP practices and 33 of those practices being rated as good. Some of those required a little support in order to attain a good outcome. One practice has been rated as requiring improvement, and we are giving some support to that practice to assist them from a quality perspective. And one practice has yet to be inspected. BB is a total of 50 care homes, and from those, none are rated inadequate. Seven requires improvement, so they again are receiving support from our quality teams and also from the local authority. 38 rated as good and 4 as outstanding. Our community provider NELFT also rated as good, and again we work tirelessly with them to understand the trajectories of quality and their areas for continued work. The challenges in the system are around the transport, the ambulance, E-East, the transport service. They were rated as requires improvements, so again they are being given intensive support from our perspective. And also, as Williams has also mentioned, there are some real challenges with the maternity services, which we continue to work and support them. I've also added in Pathology First has received full accreditation from the United Kingdom Accreditation Service and continues on their improvement journey. I'd just like to thank you all for listening. That was a very high level, but thank you very much. And I'd now like to hand you over to Natalie.
Apologies. Thanks, Eleanor. Hello, my name is Natalie Brodie and I'm the Deputy Chief Finance Officer for the CCG. The impact of the COVID pandemic meant that 2021 was a challenging year for the finance function. However, despite the challenges, I'm pleased to report that the CCG met all its statutory financial duties. The CCG remained within its revenue resource limit by delivering an in-year surplus of 150k. It stayed within its running cost allocation of 5.4 million. This is the allocation the CCG receives to fund management costs. We stayed within our cash allocation. We met all 4 payment targets to pay 95% of NHS and non-NHS invoices within 30 days. We also met the mental health investment standard by increasing spend in mental health by 5.9%. And the CCG received an unqualified audit opinion on the 2021 accounts. This means the accounts were issued with a true and fair view opinion by external audit. Next slide, please. So the CCG started the financial year with a small brought forward accumulated deficit of 131k. We received 385 million to meet service and management costs. By achieving an in-year surplus of 150k, the CCG ended the year with a 19k accumulated surplus remaining. Next slide, please. So this slide just summarises the CCG financial performance in 2021 that I've just discussed. So in terms of COVID, there were significant changes to the national financial arrangements as a result of the pandemic. The CCG only made payments to a small key number of NHS providers, with minor NHS providers funded nationally. NHSE directly funded the main independent sector acute hospitals. In months 1 to 6, the CCG expenditure was matched by funding. And in months 7 to 12, the system received a financial envelope, including a COVID allocation, which the system needed to manage within. The CCG incurred 12.6 million COVID expenditure in 2021. The next slide shows a pie chart and shows how the CCG spent its money in 2021. As you can see from the table, the CCG spent most of its money on acute services with just over 203 million, followed by prescribing at 45 million, community services at 44, and mental health at 34 million. Next slide, please. In terms of looking ahead, so from the 1st of April 2021, the CCG has been delegated to commission core GP-led primary care services and account for the expenditure. This was previously accounted for by NHSE. COVID still has an impact on the financial arrangements. The CCG has only received an allocation for the first half of the year, and we are awaiting guidance and an allocation for the second half of the year. And as William has alluded to, there still remains challenges ahead in terms of system recovery, managing winter pressures, and preparing for organisational change as we transfer into an ICS as a finance function. Finally, I would like to express my thanks to the CCG staff, particularly the CCG finance team, the CCG former CFO Dee Davey, and our finance colleagues in AGM CSU, whose input enabled the CCG to deliver the 2021 financial duties in what was a challenging year. That's the end of the finance review. I will now hand you over to Jill Jones, lay member, patient and public involvement.
Thank you for that. To introduce myself, I'm Jill Jones. I represent patient and public on the board as a lay member. First slide, please. So, under the NHS Constitution, every resident has a right to be involved in their healthcare plans, and that has been an incredibly challenging experience for us with COVID. We, as a group, as trying to be the patient representative, all the things that previously we had talked about in terms of we would normally talk about engagement has kind of gone out of the window. So the services have had to change very rapidly and very impressively to respond to the challenge of COVID. I think as part of that process, what has been really impressive is that we have taken the time to reflect on the fact that processes that previously would have taken some time, we've actually taken new and innovative ways to respond to. And those lessons are being taken forward so that we will have new structures will embrace both the challenges of the future and the lessons learned from the past. In doing this, we want to give communities the chance to be involved in shaping that future of the NHS, because that's the right thing to do, because after all, the communities are the customers and it is that we're there to serve them. Next slide, please. So I'd like to just talk you a few examples of how we have engaged with the community. So the governing bodies meetings, so the meeting we've held just prior to this one, have continued to be held in public, but we've taken those online to virtual, and those have been really successful, and we've continued to have members of the public attending those meetings and being able to ask questions of the board members. We were able to bring patients and residents to become involved in non-emergency transport planning. We recently let a significant contract for non-emergency patient transport, which was a huge exercise, and I'd like to thank everybody who was involved in that and how hard everybody worked to make sure we got the broadest possible views and experiences involved in that in order to select the right company to provide that service for the community. We've also done a lot of work working with councils for voluntary services who have been really phenomenal in responding to the challenge of COVID and in supporting us in getting more information out and helping with groups and supporting existing groups and helping to create new groups. And one of the questions that I think was asked prior to this was asked about flu vaccinations and what our plans are for 21-22. And as you can see there, we've got some responses in terms of people's attitude and how many people were involved in that. That's just a small number of examples of the kind of engagement that has been going on. And we hope now that COVID is becoming less forefront of mind, we'll be able to grow the groups that we continue to have, and we are expanding. and that we can use the lessons learned to make those more inclusive, and not just face-to-face meetings, but virtual meetings, and to find other ways of gaining people's involvement as much as possible in developing our healthcare services going forward. Thank you. Can I hand over now to William?
Thank you, Jill. So whilst on a formal basis, the AGM is obviously a retrospective look at the previous year, we thought it would be useful just to touch upon the plans for Basildon and Brentwood and what we're focusing on over the coming months and indeed years. So as I've alluded to in the earlier discussion, working with alliance partners is key to what we want to focus on in the future. And those alliance partners include existing parties from health, so people like primary care, community services, mental health, and the hospitals, but also broaden that, so social care, our local authorities in Basildon and Brentwood, the third sector, and that work will continue. Some of the areas we want to focus on include the access model. So as we said before, that there is a huge amount of pressure on the NHS now as a result of built up demand during the COVID period. However, pre-COVID, we also knew that it was challenging to get access to certain services. Our waiting times for secondary care were long, although not as long as they are now. I think some people were still finding it hard to get access to primary care as responsibly as they might have wanted. So there's a piece of work that we want to do looking at what that access model is and how do we make sure that we're making the best use of the services out there, and making it clear how our residents can access those services. Integrated working is key to the success of any future health system. You would think it's relatively easy because an awful lot of us have NHS badges that we all work together to support the population. I think in reality, the NHS is an incredibly complex beast with multiple services within it, and very few of them are used to working in a particularly joined up way. And we know that for certain parts of our population, so perhaps the frail or patients with complex LD or mental health problems, working in an integrated way is critical to actually a good experience of those patients and good outcomes. So we will continue to pursue models of working and changing the culture within our services to get proper integrated working happening. We've obviously got to keep the show on the road, so that operational delivery aspect picks up on that, and saying actually how do we make sure that throughout the remainder of this pandemic and winter challenges, etc., that undoubtedly faces in the coming months, that we continue to operate in as much of a business as usual way as we possibly can. The community development piece, I think, is quite an exciting area. So what we've experienced during COVID, and particularly the COVID vaccination programme, is that the more local we can get in our partnership working, the more likely we are to have an impact. And in particular, where we try to do some really targeted work with particular populations, that could be travellers, it could be particular age groups, particular geographic areas, or demographic groups. The closer we can get to working with those cohorts, the more likely they are to access the service and achieve the outcome that we're seeking. And so that community development work is effectively saying, how do we learn the lessons of COVID and apply that to other areas that we want to focus on? So that could be getting more people engaged in physical activity, tackling obesity, flu programs, other IMS and screening programs, and beyond, and also some of the things that our partners want to target that we can support them with. And so that's an area of focus that I think will continue to build over the coming years, and we look forward to telling you more about progress made with that. I'll now hand back to Boye for the kind of final formal part of the AGM before we move on to Q&As.
Just submitting. Thank you, William. Now we need to approve the annual report and the annual accounts, which, like Natalie said, has received the unqualified audit report. And this is mandatory for us to do at the AGM. If you because we're doing this remotely, if we don't have any dissent, then we will take it as been approved. Okay, so thank you all for that. And I think we now proceed to the question and answer sessions. We've got one question from Louise Mondi, who works in Brentwood for local charity. It's gone. And that was about bereavement. I think maybe William is able to take that.
Yep, certainly. So the question raised was around the demands placed on bereavement services at the moment, and I think BB patients that were being referred to a local charitable service, and how do we make things like that sustainable, I think is the kind of crux of the question. So in general, what we've tried to do with end-of-life service and bereavement services over the last 18 months is work really closely with some of the key service providers, and in particular our relationship with the hospices has been critically important. And indeed the hospices working with other hospices, I think part of the resilience that we've found within the system is closer working between our providers and their counterparts to better support each other. And we've invested some resources within St Luke's Hospice locally to try to offer more access to bereavement counselling. But I am cognizant of the fact that we probably aren't meeting all needs, and certainly I'd be keen to meet with the attendee who's raised that question to understand the numbers going through their services and how we can work with you to support that population going forward. So we will make sure that we follow up. I've got your contact details and get a meeting in place so we can discuss that in more detail. But thank you for raising that question.
Thank you. Thank you, William, for that answer. I did not think we have any further questions here. On that note, I would like to thank you all for coming today. I want to wish everybody well and to keep safe as we approach winter. Especially want to thank you for your support over the years and cognizance of the fact that this might be our last formal AGM meeting. It's been a pleasure to serve members of the public in Basildon and Brentwood area. Thank you all and keep well.